Hi everyone, my name is Jennifer Riekes, and this summer I did my project on assessing school meal implementation and impact, and these are the insights from my SIP fellowship. My host was UC Nutrition Policy Institute, and my host mentor was Dr. Caitlin French. The purpose of the Smart Meals study is to evaluate California's Universal School Meals program by measuring school meal participation, assessing school dietary quality, and identifying operational successes and challenges. The study aims to provide actionable insights that help schools optimize meal programs, reduce hunger and stigma, and inform state and national policies to ensure equitable access to nutritious meals for all students. This was signed in by Governor Gavin Newsom under AB 130 that aims to guarantee free breakfast and lunch to every California public school student, regardless of income. The policy's purpose is to eliminate childhood hunger, reduce stigma for students who rely on free or reduced price meals, and support educational equity by ensuring all children have consistent access to nutritious meals that help them learn, grow, and thrive. And then moving on to the project steps. The first step was to complete some basic city human subject training on how to ethically conduct research, and I then learned and practiced R&S data for both qualitative, coding, and quantitative data analysis. I then conducted 23 targeted PubMed searches on USM implementation, participation, stigma, kitchen staff experiences, outcomes, state comparisons, and screened over 7,000 results, organizing them by research question in Excel. I then identified key themes such as participation, stigma, operational barriers, as well as gaps such as kitchen staff training and the differences between state level incomes in urban and rural areas. The third step was to clean and organize survey data and then use data to run a descriptive analysis and create charts that visualize participation, staffing shortages, and operational challenges. From there, I synthesized the analysis results and literature review into a clear and actionable policy brief, highlighting participation trends, reduced stigma, operational barriers, and recommendations for sustaining California's USM program. Overall, the literature review showed that participation significantly increased, especially during breakfast. Stigma decreased as universal school meals reduced stigma for older students who had previously skipped meals. There was a positive family impact as families reported lower grocery costs, and there were significant equity gains as FRPM eligible food insecure and immigrant households benefited significantly from this program. Overall, there were some significant operational challenges as 70% staffing and 81% supply chain issues were reported. The surveys reported persistent labor shortages, supply issues, and outdated kitchen infrastructure. And in a comparison between California and Arizona and Texas, California grew participation post USM, unlike states without USM. Overall, the policy recommendations would be to strengthen workforce capacity and to upgrade kitchen infrastructure. To strengthen workforce capacity, school districts can increase funding for hiring and retention of school nutrition staff and expand professional development for culinary training opportunities. Additionally, they can partner with regional suppliers to reduce shortages and develop contingency plans to minimize menu disruptions. They can also support local procurement and culturally relevant menu design and modernize ovens, dishwashers, and storage to support scratch cooking. And in a little project reflection, I feel like I developed skills in literature review and data analysis. I was able to really translate findings into an actionable policy brief, and I gained a lot of insight into the importance of kitchen staff and community engagement, and deepened my own commitment to pursuing nutrition policy and health equity in my future MPH studies. Thank you so much. Bye.